Welcome to Mad Medicine with Miss P. Got some more venting this week, I was under the impression that when I was done with everything that I had written down, that I'd be done, but it just keeps on coming in. It's coming in, so I'm just going to give back to you and see who can relate and how much fun it is. Oh, also, I know I always think of things afterwards that I wanted to tell you. Like one of the nurses I work with, the CRNA, she says like, "You should do makeup tutorials." I'm like, "Oh, that's such a great idea," and I thought about that. But in order to do that, you would have to first see me without makeup. That's never going to happen. Like my horses don't see me without makeup. I will touch up my lipstick before going to the barn. And because horses can't throw up, I make sure that they can't see me without makeup because makeup can be more magical than you think. And when it all comes off, I cry a little. So there's no way you're seeing me without makeup. That's not going to happen. Oh, and I always want to say the YouTubers I watch that do makeup tutorials and stuff, they always say like, "Oh, I've linked the products, below if I don't talk about them. So if you're interested in any makeup I'm wearing, all the products are linked in the description." I'm just kidding. I have no idea how to do that. I don't even know what I'm wearing. It's literally like whatever's on the counter is what I grab at the time. So I have no idea. I think my foundation is AOA. It was $1. It's $1 foundation from AOA. Shot Miss A, addicted. And they're not even sponsoring me, but I'm telling you, one of the greatest things ever. Okay, so some patients over the past couple weeks have given me some very interesting things. Like one patient had this surgery. It was a circumcision, circumcision. I think that was in his private parts. I think that's what that was. The circumcision. The scion is circum. Oh, another patient said he had a hiatal hernia, but it went away. Maybe that's possible. It's all gone now. Now, symptoms go away. I was diagnosed with gastritis, duodenitis, a hiatal hernia, and I switched to apple cider vinegar, and I don't have any of those symptoms anymore. But I don't necessarily think it went away. I don't know that I healed my hernia. But all right, anything's possible. And I think I may have told you this, the shocker that really stood me still there when a patient chart's like, "Is there any other information we should know or any other medical conditions you have?" And she said, was it a she or a he? Maybe it was a he. He said, "I have a bullet in my liver." And I got the story there. That was interesting. I think I told you about that. I think that was the gal that got shot by her neighbor. Wildly interesting. And boy, do I want to know the rest of that, but I kind of can't. And then I get a lot of cancer surgery. They had the cancer surgery. That's like, can you tell me what part of your body it was on? In this case, I get this sometimes too. They had the artery surgery, where they fix the artery. It's like you have a million arteries in your body. I'm assuming we're just talking about the bigger ones, but you're going to need to be more specific. Oh, that was the heart attack bypass, because the artery, the heart attack bypass. I'm not sure exactly. I'm assuming they were having a heart attack, and that's what the symptoms brought them to the hospital. And then they had a STEMI and immediately either did a bypass or maybe stents or what is often charted as a stent. It's not the same thing, but all right. Oh, another previous surgery was a blepharoscopy. I think I told you about that one before. It's kind of like when they put a scope inside your eyelid. I guess I don't know why that would be necessary. And there's a little mark on there that says, do you have a problem with your airway? And boy, people really want to have problems with their airway. And then right after that, it says, did an anesthesiologist, or nurse anesthetist ever tell you you had a problem with your airway? That means like you were really difficult intubation. So like a deviated septum is not a problem for an anesthesiologist to intubate you. It's a nasal airway, but it's not your actual airway that we're concerned with that they're concerned with putting you to sleep. Also, I think I mentioned this before, opiates, not anesthesia. They're not anesthesia. Narcotics are not anesthesia. Just because they lessen the pain or lessen your sensory to the pain, that does not make them anesthesia. So if anybody says, "Have you ever had a problem with anesthesia?" and you're like, "Yeah, Demerol makes me sick," that's not anesthesia. That's Demerol as a pain medication. It's not it's not anesthesia. It's there in no way does that anesthetize you. If you take enough of it, maybe, but that's probably also kill you. It's not anesthesia. Stop saying that. Um, One patient charted that they take amlodipine, amlodipine. I think we're combining a few meds there, but okay. I mean, y'all have the bottles, right? I mean, like when you go to the pharmacy, they don't go home in a plastic bag, right? They're in bottles that are labeled. Write that down. Write that stuff down. And if you take like 9 different medications and you're a cardiac patient, how do you not have that written down just on like a piece of paper in your wallet, just in case? I mean, you have to know that we need to know something about you to fix it, right? Like even if you drop off your car at the mechanic, you're not like, here, my car's broken, can you fix it? You're going to say what's wrong with it and give you something. So if EMS come upon you and you're catatonic and we got nothing, at least we can go through your wallet and look through for some, I'm EMS, I would never do that. That's way too much stress. But surely you would think that there was something like, I understand the whole bracelet thing, like the diabetic bracelet, that those are very important. But at least have like a list of your list of meds can tell us everything about you. So, and I've always told this to my students, if I can't get report fast enough, I'll just go through the med list. I'll pull up the meds and I already know everything that's going on. The allergy list, I already know what's going on with you. If you're allergic to 9 different antispasmodics, you have seizures. Why else would you have ever taken any of those meds? So really, med list, super important. And after we go through all the meds, this is a kicker for me. I don't understand. I can't really comprehend what people think. Like if my AC guy comes out and he's going to work on this AC unit, when we're done the AC unit, I'm not going to ask him about my plumbing. He's the AC guy. And I know that because he came to fix my AC. So if I spend 34 minutes on the phone talking about your medical history and asking specific information about your pacer, your defibrillator, last time you saw your cardiologist, what medications you take and what to take and what not to take, and what the anesthesiologist wants you to do, and we go for all that, why would you ask me how much money you owe? What billing lady is going to go over your medications? And what nurse knows about insurance and how much your deductible is? Those are different people. Those are different departments. I cannot help you. Now, when you say like, okay, we're all done. Thank you so much. I appreciate it. Now, can you transfer me to billing? That makes sense. But when you're like, okay, and how much do I owe? I always say, I'm a nurse. I have no idea how much you owe. That's why we went over all your medications. Now, if you've got billing, I can transfer you to the billing department. But there's got to be like a little part of you that understands, the nurse that just went over in detail your medications and even did some teaching, because that's who I am. Have we met? Yeah, that's how I go. Surely there's got to be a little tiny part of you that recognizes your nurse doesn't also handle all of the billing. Just like you're not going to go up to check in with your receptionist and then start asking her about your medications or your blood pressure. She's clearly the receptionist. She shouldn't have to do that, right? Like when I take you back and have you sign your consent, you can't ask me details about your surgery and what it looks like in there. I'm not a surgeon. I have no idea. You're going to have to ask your surgeon. We're not all the same person. Like if just because we're wearing scrubs, we're not the same person. Just like when someone goes to see their cardiologist, we ask them that. I said, when's the last time you saw your cardiologist? Or I'll say, other than testing and checkups, I'll say just like this, and I'll almost go like, other than testing or a checkup, when is the last time you saw your cardiologist? Or do you have, other than testing or checkups, have you ever seen a cardiologist? And they're like, well, yeah, I saw him about 6 months ago when, he did this test and that test and this test and stuff and everything was okay. So other than testing or checkups, have you ever needed to see a cardiologist for another reason other than testing and checkups, just to make sure that everything's okay? Oh, yeah, I saw him a couple weeks ago for a cardiac clearance. Okay, for like the 9th time, I'm just going to ask you one last time. Have you ever had a reason to see a cardiologist other than testing or checkups? Have you ever been diagnosed with mitral valve prolapse? Do you have a pacer, defibrillator, open heart surgery, stent placement, any bypassing, any valves replaced, any aortic aneurysms? Have you ever had an episode of uncontrolled hypertension? And Like I have to go through the whole thing. They're like, oh no. Okay, so 10 minutes ago, you could have just said no, but then we go through the whole thing. And then sure enough, I get to the bottom of it, and he's had like a bypass. So the reason you see your cardiologist isn't for cardiac clearance. It's because you have coronary artery disease. That's why you see your cardiologist. You have coronary artery disease, and I don't blame the patient. The doctor should have said this. The doctor should have explained it in a way that this patient understands that the reason they need to go back regularly to see their cardiologist is because they have a disease requiring cardiology follow-up. And the amount of patients, when I say, have you ever seen a cardiologist? They literally will say, what kind of doctor is that? This isn't like a 19-year-old. These are like 50, 60-year-olds. I think that's awesome that they have no idea what a cardiologist is. That I hope they never find out, but I don't understand. Even if you've watched like Scrubs, I'm thinking you would be able to figure that out, but all right, maybe not. It's TIA, not TMI. I enjoyed that. I'm not gonna lie. I thought that was fantastic. You didn't have a TMI, you had a TIA. After digging around, that's what I found out. It's not too much information. It's a transient ischemic attack, but still fun for both of us. And every time I say, what surgery have you had in the past? And the past means your past. Like, what surgery have you had in your life? And I'm starting to say your life because the past is very confusing for them. And they'll say like, what, you mean recently? No, I mean your past. The past from like today's the present, all the way back to the past. And they'll say like, well, how far back do you want to go? And I say, birth. That's your past. Unless you had in utero surgery, can you just tell me what surgery you've had in the past? And the point of this is not only does the anesthesiologist need to know what's missing, what's not, what's there, what shouldn't be there. If you wake up with any sort of symptoms or complaints, we know it's not appendicitis. If you've had an appendectomy, let's hope that thing didn't grow back. I think so. But it's also how you tolerate anesthesia. If you've had anesthesia 10 times in your life, then we know it's highly unlikely that you have pseudocholinesterase deficiency. It's highly unlikely that you have a malignant hyperthermia, genetic history. That's why we want to know. Birth, that's when we want to know. All the way back to birth. What surgery have you ever had in your life? And I get, whew, oh gosh, well, look. And then after all of those noises, we can finally get down to surgery. And then they start rattling them off as if I'm not charting them, as if I'm just like, oh no, I'm just curious for myself. I'm not going to share this information with anybody else. I'm just going to keep it to myself. And then I have to say like, hold on. Do you have any idea what year that is? And then all the noises start again. Oh God, that was years ago. Okay, was it 6 years ago? Was it 36 years ago? Just save all the noises and all the drama. Just answer the question. And a lot of these, like I heard my coworker, who I love, she's so good. She's so sweet. She's like, okay, these are all yes and no questions I'm about to ask you. And you think that will make them answer yes and no. It does not. It does not. Still, 36 minutes later, she's on the phone with the same person. It's just yes and no. Just answer yes and no. They can't. They can't. They want to tell you the entire history. And this is a yes and no question. Do you have any cultural or religious beliefs that may affect your care here? Well, I'm a Roman Catholic. I don't know what that means for me. It's congratulations. I used to be Catholic also until they tried to charge me to ask the congregation to pray. But it's a yes or no question. Do you have any cultural or religious beliefs that may affect your care here? Well, I'm a Baptist. I'm not a Baptist. I don't know that there's anything. I think at this point, the only thing I do know, the only people that are smart enough to speak out are the Jehovah's Witnesses that, are sure to tell us that they don't want blood, which we couldn't give you blood. We have no blood. We're all out of blood. We have no blood to give you, but they're so afraid of getting blood. And legit, I get it. Totally understand that's your religious belief. But they'll at least, say I can't have blood products. They might be the only ones that understand that the question isn't what is your religion? The question is, do you have religious beliefs that may affect your care? It's a yes or no question. And if it's a yes, then you can, follow up. But you can't get anybody to do that. I can't get anybody to do that. Oh, okay. So there's another question. I'm going to end it with this one. There's a question on there. This is how it's worded. I swear to God, it says, when is the last time you had any aspirin or blood thinning medication and when? And they're like, yes. And then it says, what medication is it? Lisinopril. That wasn't the question. The question was, when is the last time you had any aspirin or aspirin-containing products? Or I believe in a certain area, it says, were you told to hold off on aspirin and aspirin-containing products or blood thinners or whatever it says? And they're always like, yes. And then it says, like, what was the last medication you took? And they're like, gabapentin. No. We're asking about aspirin-containing products that can affect your bleeding. They don't understand the question. And I feel like it's pretty. Some questions can be confusing. I feel like that one's pretty straightforward, but they always write in, or they'll say like, no one ever told them to stop. Yes, your surgeon told you to stop. Now, some significant cardiac patients, a lot of them won't stop because the benefits outweigh the risks of bleeding. But for the most part, most of your surgeons, other than like cataracts and that sort of thing, most of your surgeons will tell you to stop. Vitrectomies, maybe not so much. And some of them, knees and shoulders and hips, sometimes that not replacements or anything, but when it's just kind of a quick scope and they've got a significant blood clotting history, whether it's a stroke or PE, anything like that, they may tell you, or recent stents, they may tell you to stay on, and that's fine. But otherwise, they cannot understand what the question. Maybe I can ask them to rewrite that question differently. There are some things I'd like to fine tune to make it a little bit easier. But okay, that's it for today. So hugs and kisses. Miss you much. Same as always. Face your fears, forget your failures, follow your faith, and I'll see you next time.